Good afternoon. It is Saturday afternoon, 4 o'clock. It must be time for the senior moment. This is Connie Clark with Home Helpers, and this afternoon I have Breanna Bergeron with the Kootenai Diabetes and Endocrinology Center, part of Kootenai Medical Center, here to talk about diabetes. And I've got 1,000,001 questions for you, but welcome.
Well, thank you very much. It's good to be here.
Absolutely. And, okay, in layman's terms, what is diabetes?
Well, it depends on what type of diabetes you're talking about.
Good point.
There's several different types. Type 2 is the most prevalent type of diabetes. It accounts for about 80 to 90% of the cases that we see. Most of the time, when someone develops type 2 diabetes, it's not going to be a rapid onset type thing. It's going to be something that happens over a period of years. And so with type 2 diabetes, you basically have what's called insulin resistance. Your body is still making insulin, the hormone that controls your blood sugars. However, the parts of the body that need the insulin to make everything work correctly does not receive the insulin well. It's like having a door that doesn't open very well, door with squeaky hinges. So what happens is eventually your pancreas says, oh my goodness, this isn't working, I need to produce more insulin. So it starts pumping out more insulin and your blood sugars stay normal. Therefore, you don't notice the diabetes developing until the pancreas just kind of gets tired of producing that much insulin, and then the blood sugars start going up. So when the doctor diagnoses a person with type 2 diabetes, they've probably been developing it for, maybe up to 10 years prior to that point.
What does insulin do for the body?
Insulin basically is like a little doorman. It opens the door from the bloodstream where the sugar when you eat, the sugar goes into your stomach. It gets processed through the small intestine, absorbed into the bloodstream. Once it's in the bloodstream, the insulin takes it and carries it to the cell.
What does it do for the cell?
The sugar itself goes into the cell and gives that cell energy.
Oh, okay.
So that's why carbohydrate foods, which break down into glucose, are the body's main source of energy.
Okay, so it keeps your body from getting energy.
Yes,
so to
exactly.
speak. Okay.
Exactly. It keeps your body from getting the energy it needs to function correctly.
Okay.
And therefore, when people start noticing the symptoms of diabetes, they're going to notice a few things. They're going to notice they might be feeling kind of more tired than usual, just not as able to get around as well as they usually do. They'll notice increased urination. That basically comes from your body trying to rid itself of the excess glucose that's in the bloodstream because it can't get into the cells because there's not enough insulin there to take it.
Oh, okay.
So the body then just says to the kidney, which is like the body's oil filter, that's kind of how we describe the kidney. The kidney starts making more urine to help flush out that extra sugar. So people are going to be going to the bathroom more often while they're developing diabetes, or when it gets to the point where the blood sugar threshold is too high.
Okay.
You'll start noticing increased urination, increased thirst. And that increased thirst is just another way that your body's trying to dilute the concentration of sugars from the bloodstream.
And so that's one of the reasons they say don't eat a lot of sugar when you're diabetic, because you're increasing the amount of sugar in your body and your body's not using it.
Exactly. And there's a lot of misconceptions about what you can and cannot eat when you have diabetes. Again, type 2 is the one we're most of the time dealing with. The biggest thing with diabetes is not exactly what you're eating, it's how much you're eating at once. Someone with diabetes can still have, you can have a small piece of cake. You just have to emphasize the small part.
Okay.
And, again, watch how often you're eating that piece of cake. You don't want to be having cake at every meal. A small piece of cake at every meal every day is going to add up to a lot of cake. But if you just say, okay, I can allow myself a treat once a day, moderately sized, it's okay.
What causes the body to reject, I guess that's a good word, I don't know, to not use the sugar? What kind of things cause that to happen?
It's a lot of different things. As we get older, the risk of diabetes increases just because your insulin resistance increases a little bit. And as we get older, we do tend to, a lot of times gain weight as our metabolism slows. And the weight gain causes the additional insulin resistance. As we get older, body parts get older too.
Wear out, so to speak.
Yeah, and then your pancreas, as it's getting older, it can't hyperproduce the insulin, as it has been to compensate for the insulin resistance. And so that's when you start to see the blood sugars go up, because you're no longer able to produce enough insulin to force those cell doors open. So again, back to the frequency and the amount that you can eat. It's easier for the body to process small meals more frequently given throughout the day, rather than, not eating breakfast, not eating lunch.
And going to the buffet at night.
Exactly, exactly. That's why you always hear your physician saying, I'd rather have you eating small meals more frequently throughout the day rather than just that huge, like you said, the buffet meal, because that's pretty hard for your body to accommodate that. It's just much easier to keep the pancreas doing a little bit of work, on a consistent basis than, telling it, okay, you get the morning off, and then expecting it to produce enough insulin to cover an entire day at once.
That would be like sitting around and exercising none for 10 years and then trying to run the Ironman.
Exactly.
Okay.
Exactly.
Okay. And I know there are a lot of veterans out there who were exposed to Agent Orange who are now coming down with diabetes. So I would imagine environmental factors probably have something to do with affecting the way your body is working.
That's kind of a tough thing to establish. We do have a lot of people that were exposed to the whole Agent Orange thing,
Mm-hmm.
and it's kind of tough to say if they had an increased risk of developing diabetes because of that, or if they already had a strong family history. That plays a lot into it. If a person's, if both of a person's parents have diabetes, the likelihood that they will get diabetes is fairly high. That's why when you go to the doctor, you're always asked to fill out that medical family history form, because the doctors are looking for, okay, yeah, they have heart disease, they have diabetes, they have this, just to assess your risk for getting that particular condition.
So then what you're saying is it is more prevalent as we get older because our bodies just kind of get tired?
Mm-hmm. And it's age is a risk factor. And again, being overweight is a risk factor. So the more active you can be as you get older, and, if you can, make an attempt to eat healthier as we get older, it does decrease your likelihood of getting diabetes. However, again, the genetics does play a fairly large role in determining who gets diabetes and who does not, because you'll see a lot of very overweight people who don't have diabetes, and then we do have some patients who are fairly thin and fit, and they have diabetes. I mean, they may not be doing an Ironman, but they're not
right.
Your typical.
But it's genetics.
It is. It's a lot of genetics.
And you talked about diet, and I see, there's all kinds of initials after your name, and one of them is registered dietitian.
Mm-hmm.
So in diet, you mentioned carbohydrates because they go to sugars,
Mm-hmm.
and fruits have a lot of sugars in them.
Mm-hmm.
So what would you say someone who is a type 2 diabetic or who is approaching that
Mm-hmm.
should eat or restrict? The piece of cake.
And typically, again, that's something better individually assessed for each person based on their age, their activity level, their gender. There's a lot of different factors that go in there, and it's hard to give a broad overview for what would be appropriate for every single person,
Mm-hmm.
just because it does differ so greatly. So what I would suggest is if you have questions about that, there's dietitians just locally. You want to look for a credentialed nutritionist, or a credentialed dietitian. one with an RD, LD behind it, or, our clinic is always available at the Diabetes and Endocrinology Center there by Kootenai. Again, I could give you generalized terms, but it's just so different for every single person that, it's better just to kind of meet with somebody, get an assessment, and then go from there as far as what would be appropriate for you.
So what would you look at? You would probably look at their activity level, their weight.
Yep, their current weight.
What their glucose level is.
Yeah, and that kind of factors into what their medication plan will look like as well.
Okay. Do you look at the history? Because I had talked to someone off the record personally, and they talked about looking at your numbers over a period of time that, you might have been under that 100 mark. I guess that's the cutoff to start being nervous.
Well, the 100, if you're over 100 fasting, then they consider that, quote unquote, pre-diabetic. The actual cutoff for clinical diagnosis of diabetes is 126 fasting. However, the doctor can make the diagnosis before that point if he thinks it's
because you're getting there.
Because you're getting there.
And she had talked about looking through the past to see, you might be under that number, but 5 years ago you were 90, and then the next year you were 92, and then the next year you were 94, and then it was 96. So you were fine every year, but when you looked at the trending numbers, you were getting higher each time. You just hadn't reached that magic number yet.
Right. And, they won't diagnose anything under 100, but like I said, between 100 and 126, I've seen them diagnose diabetes, at that point.
But I would say if you looked at those numbers, you're getting there. So you need to...
If you're noticing a gradual trend upward, and, you definitely want to take notice and, discuss it with your doctor and say, hey, I've been a little concerned about this. Everything seems to be going up every year. And they're probably going to catch that as well and, kind of just have a little chat with you. Even though diabetes is, it does, your genetics do play a lot into it, you can do a lot to prevent it, even if you are genetically, predisposed to it. Or if not prevent it, delay it for quite a while, because if you can start making some of those diet changes before you get into the quote-unquote diabetic state, again, you can probably avoid having to test your blood sugar every day and, taking medications and that type of thing for a very long time. We've had some people be diagnosed with prediabetes. They came and, got some help and made some lifestyle changes. And they stayed in that pre-diabetic state for years until, maybe they got into their 80s and they slowed down quite a bit more and then developed type 2.
So if you wanted to know if you were pre-diabetes, what would you do? How would you do that?
Basically, all you have to do is go in and get your annual physical, and they should do a blood draw on you. And it's very simple. It's just doing a fasting glucose, and the doctor takes a look at that. And if he has concerns, then they can do some further testing if they choose, or if the number is above 100, then they'll probably just go ahead and make the diagnosis.
But if you're 96, 97, 98...
They usually won't diagnose then, but they probably will. You probably will. They'll say, hey, you're
getting close.
You're right on the edge there, so just kind of watch it.
So when they say watch it, what do you do?
In that case, that's a good question to ask the doctor. If they're that vague about it, then you want to say, hey, is there somewhere I can go? Can you refer me to someone that I can talk to that can give me some tips on what to do with my diet, what to do, ask your doctor. If they say, well, you need to exercise more, ask them for specifics on that. Because, again, exercise should be just as individualized as, nutrition. There's some people who are okay going out and starting to run 3 miles a day. There's some people that should start walking 5 minutes a day at most and work their way up. Not everybody's at the same place as far as physical activity goes. So you need that to be individualized as well.
So if you think you're getting there or you're concerned about it, bring it up to your doctor.
Absolutely.
And if he's or she's not really sure, ask for a referral.
Referrals. Absolutely. And usually they're more than willing to give them. Referrals, to, dietitians. They're certified diabetes educators for the nutrition part. Referrals to if, there's some type of a physical limitation as far as movement goes, they can usually refer to physical therapy to try to get you more mobile so you can work out or, move around and get some activity in.
So you don't have to just sit around and wait for it to happen.
Absolutely not. That is one of the good things about diabetes is, you can prevent it or greatly delay the onset of it. And if it does happen, if the doctor does say, you have type 2 diabetes, you can control it, whether that be with diet, whether it be with diet and exercise, whether it be with diet, exercise, and medication. It can be controlled.
Interesting. Well, we need to take a break, but we're going to come right back and continue this conversation about diabetes. You've been listening to Breanna Bergeron with the Kootenai Diabetes and Endocrinology Center, and we will be right back.
That's very good. That's a mouthful. I know. When we answer the phones at work, good morning, Kootenai Diabetes and Endocrinology Center. It's, especially before you've had your coffee.
Oh, yeah,
I get that one out.
Okay. All right. So then let's continue on with this conversation.
Okay.
We've talked about medications. What does that mean? If when you're diagnosed, you all of a sudden go on shots, or
Right.
let's talk about all those other options.
Perfect. And then maybe like potential complications and how to avoid that.
Exactly.
Okay. Perfect.
Okay.
Perfect.
How's that? And we're back. Again, you're listening to The Senior Moment. This is Connie Clark with Home Helpers. And this afternoon, I have Breanna Bergeron with me with the Kootenai Diabetes and Endocrinology Center in Coeur d'Alene. They're located right behind Kootenai Medical Center. Mm-hmm. And we've been talking about diabetes. And the first half this afternoon, we've been talking about what diabetes is. Mm-hmm. So far as your body's concerned, what it means and how we find out if we've got it. Now, all of a sudden, let's say we've been diagnosed with diabetes. Does that mean all of a sudden we're on insulin shots, or what does that mean?
It really depends on what type of diabetes you've been diagnosed with. With type 1 diabetes, and we talked a little bit about the development of type 2 diabetes earlier in the show. That is the more prevalent type of diabetes that you're going to see, but older people can actually be diagnosed with type 1. Type 1 diabetes is what used to be referred to as juvenile diabetes, but because they're starting to see now that older people can also get type 1, they now have switched the terminology from juvenile and adult onset diabetes now to type 1 for juvenile diabetes and type 2 for, quote unquote adult onset. So if you are diagnosed with type 1 diabetes, you will automatically go on insulin. No questions asked.
What is type 1? What is the difference between the two?
So type 1 is basically an autoimmune disorder. What happens in type 1 is that your body actually attacks the cells in the pancreas that produce insulin, and it destroys all of them. So your body is left completely insulin deficient, unable to produce insulin. And we talked a little bit before of insulin's job in the body. It is supposed to take glucose, which again is the body's main fuel, and deliver it from the bloodstream into our cells.
For energy.
Yeah, for energy. So your muscle cells, your brain cells, all those cells that perform different functions in your body need that energy from the glucose. So because with type 1 diabetes, your immune system kills all those cells that produce the insulin, they're called beta cells in our pancreas, you don't make any insulin, therefore you need insulin from the outside to make up for that. So that's where the shots come in.
Okay.
So in type 2 diabetes, we talked about how your pancreas will still be producing insulin. The only thing it's having to overcome is that insulin resistance. Basically, remember we talked about how insulin resistance is kind of like rust on the hinges of the cell door. It kind of makes it just harder to open that door, so you need more insulin to open the same door that maybe one little insulin could have opened before. Now you need 3. So it just requires more work. With type 1, there is no doorman. The insulin are gone, so there's nobody there to open the door.
So the pancreas is pretty much dead.
The pancreas itself is not dead. Only the cells that produce insulin.
That part of it.
That part of it is
okay.
dead. Yep.
Okay.
All the other functions of the pancreas are still alive and well. It's just the insulin producing portion.
Wow. So if you're diagnosed with type 2, your pancreas could still be producing them, but it might get tired.
Absolutely.
Because it's being overworked.
It's being overworked, and it's getting older. So the combination, just like a human doing a job. If, at 20, we might be able to work 80 hours a week and get away with it. But
at 80, we can't. Okay.
It's just hard to deal with that at 80. Okay. Your pancreas feels the same way.
Okay. So if you're diagnosed with type 1, and is that all of a sudden you're diagnosed, or is that another gradual?
It's actually type 1 is usually more rapid onset. Usually, while type 2 can develop over a period of years, people will usually notice type 1 within, a month. At the very most, it'll be going on for a month before they realize, because you get very, very, very sick when you're diagnosed with type 1 most times.
Nausea sick or tired, can't move, beat up kind of
all
sick?
All of the above.
Okay.
You can, more than likely, you're going to be very fatigued because you'll be getting no energy whatsoever to the cells. A lot of people come in when they're first diagnosed throwing up because with no glucose to power the body, it has to switch to a different energy system, which basically breaks down fat at a very rapid pace. And basically, the byproduct of that process is a very acidic compound, which your body doesn't like. So therefore, you get nauseated, you throw up. So it's not pleasant. Getting diagnosed with type 1 diabetes is usually a little bit more, I guess, physically dramatic would be a way to put it.
And that would probably, you'd see a rapid weight loss.
You would see a very rapid weight loss because, like we said, you're not getting energy from your carbohydrates. All of the carbohydrate that you eat is, for the most part, being urinated out because, remember, I said the kidneys start collecting that excess glucose from the blood, making urine and disposing of the glucose. So what you're having to turn to is your fat stores, and fat is basically stored energy. So you're turning to the fat stores, which in turn make you lose weight very rapidly.
Okay. So if you're diagnosed with type 1, you're going to go on insulin shots
right
and probably
away.
A pump and all of those other things.
Yeah, and you can go on a pump. You don't have to go on a pump to survive. You can survive on insulin shots very easily.
But if you're diagnosed with type 2, that may not be the case.
Absolutely. Most of the time, people diagnosed on type 2, if it hasn't been going on, if it's not a severe case where the blood sugars are up into the 500s and 600s, they'll usually start them on oral medication at first.
And just to see how things are going.
Just to see how it goes. And a lot of times that oral medication will work for years and years and years and years and years. However, most of the oral medications are targeted at either getting the pancreas to produce a little bit more insulin, because it's kind of like somebody taking a cattle prod and poking those tired cells and telling them just to keep going, even though they're tired.
Do it.
Yeah,
okay.
Exactly. And there's other medications that make your cells more sensitive to the action of the insulin that your pancreas is producing.
So it adds oil to the doors?
It's very good. It adds oil. It adds oil to the hinges.
Okay.
So that's what some of the other medications do. Some of them partially block some of the absorption of carbohydrate in the gut, so that you're not, when you eat carbohydrate, not as much of it is getting absorbed as quickly. And then some of them are actually, they keep some of the good hormones that help insulin to work from breaking down in the body, because a lot of times in type 2 those hormones can be broken down and degraded too quickly. So there's a lot of different oral medications with a lot of different functions. And so with type 2, you can function on those for a very long time, and for some people it's indefinitely. Some people never go on insulin.
So that's why you would see people And I'm thinking my brother-in-law, because he's on probably 20 different medications. That's why if they would put you on one thing, and if it didn't work, they'd add something else. So they've got the cattle prod going on the pancreas, and that's not working. So then they've got the oil can going for the cells, and that may not be working. So they're adding different
agents to work on different parts
different
of the problem.
things. Okay.
So, like I said, some people will never go on insulin. However, in type 2, eventually, the body just you can only prod those cells so many times before they finally just say enough.
I'm done.
Yeah.
Okay.
And then at that point, a lot of times the doctors will start patients on a once-a-day insulin shot just to cover your overall, basal insulin needs, and then from there it might progress to more shots after a few more years.
Like after you eat, or
usually
before
mealtime shots are given before you eat.
Okay.
So it just kind of depends on each situation. But like I said, type 1, there is no oral medication.
Right, it's immediate
to shots. But with type 2, some people, even if they're diagnosed early enough, and they, a lot of times they just control it with diet and exercise. So some people don't even take pills. They just, make modifications to their diet. They make modifications to their activity level. And between those things, spreading out the distribution of carbohydrate through the day a little bit more evenly, and getting some exercise in there to make exercise in itself actually makes the body more sensitive to insulin. That's why the doctor's always harping on you to get more activity and get more exercise, is because overall it does help with your blood sugar control.
Now, 2 questions. The first one, so if I just eat a piece of cake that's sugar-free, does that really make a difference?
Oh, that's a loaded question.
Or because there's carbs in it that turn to sugar, really doesn't make a big difference.
Sugar-free candy and sugar-free stuff is kind of an interesting topic, because there are some things that are sugar-free, such as diet beverages, diet soda, diet lemonade, whatever. That truly is sugar-free and carb-free. It doesn't have anything that's really going to make your blood sugar go up. When we move on to food, it's kind of a different story, and this is where a lot of people get confused, and this is where we see a lot of problems crop up, because, we have, the food companies have to sell their product, and they know people are trying to be healthier. And so they put these big labels on the front of their boxes that say sugar-free or low carb or whatever. It may be lower in carbohydrate than their original version of that product. However, most times foods will still contain carb. If the original contained carbohydrate, most foods will also contain, most of the sugar-free versions will still contain carbohydrate. So we kind of need to look at the difference between carbohydrate and sugar to explain this.
So the piece of cake still has the carbs, which are going to go to sugar, even though it was made with Splenda or something like that instead of the sugar.
Because every carbohydrate food will break down into glucose, regardless of whether it's sucrose or, sucrose is basically table sugar. Whether it be, table sugar or your slice of bread, that's all going to break down into glucose eventually. So with that, the little sugar-free cookie that you see, at the grocery store, it's going to have carbohydrate in it.
Which are still going to be sugar.
And it's going to break down in your body to glucose. So what you really need to look at is your total carbohydrate intake, not just the sugars. A lot of people, when they've been diagnosed with diabetes, say, oh, I'm watching my sugars. And they don't take into account pasta. They don't take into account rice. They don't take into account milk or fruit. So it all needs to be incorporated in there.
It's not just processed sugar.
It's not just processed sugar. And that's where I think a lot of the confusion lies, and where, a lot of people don't make that connection, and they're trying their hardest with the knowledge that they have to eat better, but they're still noticing their blood sugars are high. So a lot of it's just differentiating between, you know, what actually will make my blood sugar go up, and what is just kind of propaganda. Your sugar-free foods, all
Right.
that stuff.
Okay. Okay. I thought I'd throw that out there.
No, that's a very good question, because a lot of people get confused about that.
Absolutely. Now, you had said that exercise and talking about blood flow. And that's one of the things that happens when people have diabetes, that it affects the blood flow in their body. Is that correct?
Well, the what I was talking about with the exercise was actually the blood sugars, the sensitivity. Remember how I said it's kind of like the oil, the rusty hinges on the door? The exercise helps increase the sensitivity. It helps oil the hinges. So as far as the blood flow goes, it's what we kind of worry about with diabetes. And people have probably heard the horror stories about the complications, and
That's where I was going with this. Yeah,
absolutely. So it's there's several different things we want to be very conscientious about looking at. One is your eyes. If you're diagnosed with diabetes, you want to make sure you get annual eye exams, and you want to get those done typically by an ophthalmologist. They'll usually dilate your eye, and what they're looking for in there is any damage to the little tiny blood vessels that run inside your eye. They're looking for any damage to those, so that if there is any, they can go in there with a laser and correct it before it causes any problems with retinal damage, anything like that. So again, that's a complication that can be prevented as long as it's looked after.
Well, I want to continue on that because that's real interesting, plus all the other things that we're talking about, the effects of diabetes. But we need to take a break, and we will be right back. Okay, so why is it the increase in blood flow or the decrease in blood flow?
The blood flow thing, it's typically it's the sugar in the blood. It's the extra glucose in the blood.
Okay.
That kind of causes those capillaries are so tiny. If the concentration of sugar gets too great, it's kind of like sandpaper. It'll kind of break them apart, and when they break apart, your eye tries to grow new blood vessels.
Oh, okay.
And when it does that, they're not really functional blood vessels that they grow. They just kind of get all tangled up in there.
And does that the blood going to your eyes, does that enable you to see?
You'd probably have to ask. I don't know much about the function of the eye in general.
Okay.
I just know that, like I said, when that damage occurs, when the capillaries are damaged, they try to grow those new vessels.
So it could affect your eye.
Oh yeah,
health.
it'll
Okay.
affect your vision.
Now, is that the same thing that happens with the circulation going to your feet?
With your feet, there's a couple of things. It's the circulation is compromised somewhat, and then also
that's why I was thinking that the circulation.
Yeah. Okay. So the circulation in your feet, there's the circulation, and then there's the nervous system. And the nervous system, when you get diabetes, on your nerves you have little. Well, if you look like any type of wiring, there's an insulating cord around it. Your nerves are the same way. It has an insulator around it. It's called the myelin sheath. After a while, that sheath gets rubbed down, like with a sandpaper, sanded down, and then it basically those wires underneath are your live nerves, and they're exposed, and so you can start getting. They call that neuropathy, where you start getting the tingling in your feet.
So is that the sugar going to your feet? Doing that?
Yeah, it's the sugar in the blood on the kind of rubbing against those nerves.
Okay. And since your feet have one of the larger blood veins in it, then is that why they're the first ones to go?
Usually it's more so because they're the furthest from your heart, and you're fighting against gravity.
Okay.
In order to clear an infection, you have to get your white blood cells down to that infection site and take care of it, heal the wound. But getting it down to your feet and back up to your heart, it's basically, like I said, the furthest thing away from your heart. So it's going to be the slowest healing thing. So you've got the fact that you can't feel an injury happening on your foot because of the neuropathy.
Usually delays you doing something. I don't know.
Yeah, it delays you doing something about it. So you cut your foot. You don't know you cut your foot. You don't look at your foot every day, at the bottom of your foot. And so you see that, all of a sudden you're putting on your sock, and I've had actually people tell me they were putting on their sock and their foot caved in. And they didn't feel that going on.
So would that be equivalent? So if I had a cut on my arm and I didn't pay any attention to it, it would probably get infected really bad.
Well, you don't have diabetes, though, do you?
No.
Right. So it's worse if you have diabetes, just because they have a harder time healing wounds. So if the sugar's under control, it's not as much of an issue. But
and is that, I'm trying to understand. So does the sugar take up the space in the blood vein where the white blood cells?
Let me see. I'm trying to think back on that, on the mechanism there.
I'm just thinking,
I think, no, it's not that the sugar's taking up the space in the blood vein. It's that I think your circulation is somewhat diminished because with diabetes, people tend to have worse cholesterol problems, so the arteries have been a little bit more.
They don't have as much space in them.
Yeah, when your cholesterol builds up before you have a blockage, it's kind of it's like here's your artery, and it just starts collecting along the wall and keeps getting narrower.
So it makes the flow. Okay.
Yeah, it makes it harder for it to get there.
That makes sense.
Yeah. So.
Okay. All right, I was just trying to, in my mind, figure it out. All right, you ready?
Ready.
And we are back on the Senior Moment. This is Connie Clark with Home Helpers, and I'm talking to Breanna Bergeron. She is a registered dietitian and a certified diabetes educator. Goodness gracious, all these letters.
I know.
She's with the Kootenai Diabetes and Endocrinology Center here in Coeur d'Alene, and we've been talking about, first off, what diabetes 1 and diabetes 2 are, and second of all, some of the medications that you would take if you were on diabetes. And now we're talking about some of the complications. And you had started talking about the eyes. Mm-hmm. Explain why, if you've been diagnosed, and I would assume with either one of these.
Absolutely, either with type 1 or type 2 diabetes.
Why it's important to have your eyes checked.
Absolutely. When you have diabetes, there can be some small vessel damage in your eyes that can occur. If you get that regularly checked out by your ophthalmologist, you go to your eye doctor, they'll typically dilate your eye. They look in there and they see if there's any vessel damage, and if there is, they go in and they can correct that with laser surgery before it becomes an issue. If that gets let go too long, it can start damaging your retina in your eye, and basically that's when someone possibly goes blind, is when it's been left unattended.
And you said that's due to the excess amount of sugar in your bloodstream. Mm-hmm. Being something like sandpaper.
Mm-hmm. Yeah, kind of just, being a little bit rough on those vessels, and they're so tiny, it doesn't take much to damage those little tiny vessels in your eyes.
So that's one thing. And I know a lot of people have heard horror stories about people having diabetes and having to have their toes removed, their feet amputated. Mm-hmm. What causes that to happen? What's that all about?
So a lot of times in diabetes, people develop something called neuropathy, and that's when your nerves, which is how we feel things, how you can feel that your hand is touching a desk, or that the burner on the oven is hot. Your nerves, kind of the same sandpaper principle. You can have damage to the insulating sheath around the nerves from the high blood sugars. And once your nerves are outside of that insulation and they're exposed, damage can occur, and therefore you sometimes can't feel when an injury is occurring. Let's say, you're out in the garage, you're in your bare feet, you step on a nail. If our nerves are working properly, we're going to think,
you're going to scream.
Oh my gosh, yes. That really, really hurt. I just stepped on a nail.
Or something like that.
Exactly. But if our nerves are not working properly, you can step on that nail, not feel a thing. And because not all of us look at our feet every day before we go to bed, or at any point during the day, really, who looks at the bottom of their foot every day?
It's been a long time. Yeah.
So, if you can't feel it, you can't see it, you don't see it, it can sit there and become infected, and that infection can a lot of times turn very serious, and that's when the amputations happen, is when those injuries go unnoticed. And because when you have diabetes, not only the nerves can be affected, but your blood flow also, if you have some cholesterol issues, if you're having some circulation issues with that, which a lot of times does tie in with diabetes, you're not able to get a lot of those white blood cells that are meant to go down and heal wounds to that site, to that injury, to heal it very quickly. So between the fact that you don't know the injury is there, it's clear down at your foot where,
it's furthest away
from your heart, the supply, getting those white blood cells down there. And the fact you didn't know it's there and it's just sitting there and festering on your foot, that's where the trouble can occur. So to avoid this, we encourage people every day to check the bottom of your foot.
And we talked about this a while back, an ingenious way to do it. I thought that was so interesting, especially if you live alone.
Absolutely.
And you can't get your foot up there to look at the bottom of it.
Absolutely. And realistically, who can do that anymore past the age of 15
Not
or
many.
so? Not many of us have seen the bottom of our feet on our own accord. So what we have people do is just go to the dollar store and get a little, one of those little hand vanity mirrors, and place the mirror on the floor and just hold your foot above it. And you can see everything that's going on there on the bottom. You can check. You want to kind of try to check in between your toes as well, because a lot of what can happen is you can get, especially in the winter, we can get dry skin and it can crack. And so that's another source of infection. So it's really important that even though, not everybody sees our feet in the winter, that we still take care of them. You want to keep your feet moisturized in the winter. Make sure, particularly you're making sure your heels are staying nice and moisturized, because
those crack a lot in the winter.
Yeah, we see a lot of cracked skin on the heels in the winter. So you get a nice thick cream. You can pick up any good one. I think there's one called Eucerin that they sell at Walmart. It just comes in a nice tub, and you just put that, on the heel of your foot and on the ball of your foot, anywhere where you might see cracks occurring. You usually don't want to put cream in between your toes,
because that gets moist and damp.
It gets too moist and damp, and you don't want that to happen. So just especially your heels, and then you can put a white cotton sock on over it and go to bed, and that kind of helps it soak in, and it keeps it from getting all over your bed sheets too.
And I've heard a lot of people talk about don't clip your own toenails when you're diabetic, and I always thought, well, what does that mean? But that is in case you might get cut.
Absolutely.
With the clippers, right?
Well, and actually what happens more often than people actually cutting themselves with the clippers is they'll trim a nail, and they try to trim around the crescent of the, into the corner. Yep. And a lot of times you can start an ingrown toenail that way. And
okay.
That's where the big problems happen. It's not so much people actually cutting their skin with the nail cutters. It's that, they'll end up tearing part of the toenail off, and it'll make an ingrown.
On the end?
Yep, on the end. So a good way to avoid that is to cut straight across on your toenails. Don't try to cut around the crescent at the corners. Just cut straight across, and then take a nail file and file down the corners. That way you're not as likely to get, one of those hangnails where you have to pull it off at the corner and end up getting an ingrown toenail. Another thing that some people choose to do is actually have the podiatrist do it. If they see a podiatrist, they do offer that service where they will trim your toenails for you. And for some people, who have lost a lot of mobility, or they just don't feel comfortable trimming their own toenails.
Or can't reach them.
Absolutely. That is a very good option. So, check with your doctor. They can refer you to the podiatrist, and they can take care of some of those issues for you.
And so one of the other issues having to do with diabetes is the inability to heal.
Absolutely.
So if you have any kind of cut or scrape or anything on anywhere on your body, that could become an issue, not just on your foot.
Yes. So anytime you get an injury, or I should say a wound on your body where the skin is broken, you want to make sure and keep an eye on that. You don't just want to assume, it's going to heal up like it did when you were younger, because it can become an issue fairly quickly. So you want to make sure, you're cleaning out, the cut, keeping an eye on it. If you start to see any redness, streaking from the wound, you go directly to your doctor. You don't mess around with that, because a wound anywhere can become an infection. However, they are more common on the feet than anywhere else. So, and again, it's because it's not a place that we typically look a lot, the bottoms of our feet. So any wound, though, you want to keep an eye on and make sure it's healing properly.
So when you see people who have had different parts of their lower extremities, I'll just say it that way, amputated, it's because things haven't healed.
Correct.
It's not just because they had diabetes.
No, it won't. The diabetes itself won't just grow a wound on your leg or anything. There has to be some kind of event that took place. It can be something as small, though, as a blister having popped and, having the skin open and that forming, an infection.
So it doesn't have to be a cut or a nail or anything like that?
It doesn't have to be a cut or a nail. It can be a blister. It can be, the blisters happen a lot. I had one gentleman actually break his ankle, I think, and the bone, it caused a little, I think, tear in the skin, and he didn't go to the doctor for either one.
Ooh.
And ended up with a raging infection and a broken bone.
Wow.
So, you really don't want to ignore things like that.
And a lot of seniors, I could see them doing that, especially as you get older, your skin becomes paper thin.
Absolutely.
So you could just touch something and it's going to give you a tear in the skin.
Yes.
And because you're older, you heal, I'm assuming because you're older, you heal slower. And so you would have a tendency to ignore that.
Yeah.
But that shouldn't be.
Anytime, you're noticing that you're having trouble healing, it's been, a week or so and you're still not seeing any improvement, you want to go to the doctor. And like I said, anytime you see, redness around the area, or particularly, like I said, streaks red streaks coming from the wound to a different part of the body, you go straight to the doctor. It's not worth risking it, and they can better assess, the problem at hand, and they can tell you, okay, that looks okay, or no, we better put you on antibiotics, because again, it's something that is different for everybody, but if ever in doubt, just play it safe.
What are some of the other complications? I know we've all heard the ones about the feet. I didn't know anything about the eyes.
Yes.
What other kinds of things can come with diabetes?
Another big one has to do with your kidneys. And we talked a lot about, when we were kind of talking about how diabetes develops and some of the symptoms you can have with the frequent urination. Like I said before, the kidneys kind of act as the body's oil filter. It takes your blood and kind of cleans it and recycles it back into the body. Your kidney also produces new red blood cells. So the kidneys are a wonderful organ, and we should all love our kidneys very much. So in that process, if you have high concentrations of glucose in the blood at all times, so if your blood sugar is just it runs high, if you're not watching your blood sugars or whatnot, it's going to start, again, kind of, I just refer to it as the sandpaper effect. It just wears on those kidneys, and it damages your kidneys. And so what can happen after years and years and years of that is your kidneys can get damaged enough to the point where they fail. And so again, it's another very good argument for keeping your blood sugars under wraps, because what happens when your kidneys fail is you end up having to go to the dialysis center 3 times a week and have a machine do what your kidneys did before.
And that's cleaning your blood.
Yep.
My goodness.
So, yeah, it's definitely, the kidneys are a big one. Again, it's the kidneys, the feet, and again, the eyes. People will a lot of times associate the blindness part of it, but they just don't know why it happens. And then also the one that gets overlooked more as just heart disease itself is actually the fact that it's a lot easier. People with diabetes are a lot more prone to heart disease itself, just because you have that glucose running through your blood vessels every day, and the higher the concentration, the more it kind of wears on the insides of those vessel walls. And so if you've ever painted furniture before, I don't know if you've refinished. I do a lot of refinishing. I love getting old stuff, sanding it down, and giving it a new life. Part of that process is sanding it down so the new paint adheres to the surface better. If you apply that to your vessel, your vasculature, that blood sugar acts like the sandpaper. It roughs up, or the glucose, acts like the sandpaper. It rubs on the inside wall of those vessels. Therefore, when you have cholesterol running through your bloodstream, that cholesterol just sticks right to the walls of that blood vessel. So because it's a rougher surface, it's easier for the cholesterol to stick to, so you start getting more buildup of cholesterol around the arteries and the blood vessels.
Which makes the pipe smaller, which makes the heart beat harder.
Yep, which makes the pipe smaller and eventually can cause stroke or heart attack, because when it's the pipe to our brain that causes the stroke, and obviously it's the pipe to our heart or coming out of our heart that can cause the heart attack. So you get enough of that cholesterol buildup and you're going to have problems. So again, if you can keep your blood sugars under control, you can further decrease your risks for those cardiac events.
For a lot of things.
The stroke events, yep.
Good grief.
A lot of things.
Wow. Every time I talk to especially you, I learn so much. If somebody has questions, has issues, wants you to come and talk, how can they get a hold of you?
We have a direct line to the clinic. The number there is 208-666-3165. And you can either set up an appointment with the diabetes educator. If there's a group interested, a senior group interested, in someone coming to talk to them as a group, that can probably be arranged as well. We also have a board-certified endocrinologist at the center, which in layman's terms is a diabetes doctor, basically. But she does diabetes. She also does other disorders of the endocrine system, such as thyroid disorders, any issues with testosterone, estrogen, anything like that. She will also address. So.
And if you go to your doctor and you're concerned about your glucose levels, and you're not getting the kind of answer you want, you can ask for a referral.
Absolutely.
And these folks at the Diabetes and Endocrinology Center can work with you to find out what's going on, what you can do before you have to go on medications. If you do have to go on medications, explain all of it to you.
Absolutely.
So it's just not a pill you have to take.
Exactly.
But it's either the cattle prod or the
yes,
the
exactly.
oil can. And if you've been listening,
exactly what all those pills are doing.
If you've been listening, you know what those mean. But this has been very interesting. And again, if you have any questions out there, call Breanna and her team over there. They'll be more than willing and able to answer your questions, to help you through your journey, and to try to make sure you stay healthy.
Absolutely.
Because diabetes doesn't sound like a fun thing, and it sounds like it affects every single inch of your body.
And the good thing is, though, is if it does happen, it can be controlled. So
that's a real good thing. So thank you, Breanna, so much for your information this afternoon. And again, if you have any questions, call over at 666-3165 over there, or you can get a hold of me at Home Helpers, and we'll send you over to Breanna and her team. Thank you so much.
Thank you.
And you've been listening to The Senior Moment, and you all have a wonderful rest of your weekend. Have a good day.